Support for Radio Friends comes from Labrunerie Financial, where they work to ensure a lifetime of financial security for people from all walks of life, from investment services to retirement plans. If you're looking for a trustworthy company that has the experience and knowledge to put your interests first, contact Labrunerie Financial, a community-based investment counseling firm since 1966. Good morning and welcome to Radio Friends on this Monday, August the 1st. Our guest today is Heather Harlan, and she was supposed to be sitting right here in the studio with me, but we got a call last night that Heather had become exposed to COVID. She is fine, but she was close to someone who was diagnosed with coronavirus, and she, out of an abundance of caution, she decided that it would be better if we did this over the phone instead of coming in. And Heather, okay. I appreciate your concern. So welcome to Radio Friends.
Thanks. It's great to be here, Paul.
Yeah. You're feeling fine, right?
I'm feeling fine, but it's just we know this new variant is very easy to spread. So I can work from home. So I'd rather be in the studio with you, but this will work. We'll make it work.
But you know, I think this really is important to point out that perhaps we've slid back a little bit in letting our guard down, but it is important. It is important not only for yourself, but for other people around you.
Right.
And if you have any concern, we'll just stay home, right?
Right.
Okay. So, Heather, you're with the Columbia Boone County Public Health and Human Services Department, and you wanted to talk a little bit today about the opioid crisis. And I guess I don't use that word lightly. There is a crisis with opioids.
Right, Paul. You know, the coronavirus has grabbed all the headlines on public health, but we've really neglected to pay attention to the many people who have died from drug overdoses, accidental drug overdoses. 107,000 Americans last year. We won't see any flags at half-mast for their passing. So I wanted to alert people again as to what's going on with this.
Why do you feel that we have such a crisis with opioids?
Well, I'll tell you right now, it comes down to one word.
Fentanyl.
Fentanyl is a synthetic, lab-based opioid. Opiates are plant-based, like heroin.
Yeah.
Fentanyl is cheaper, easier to produce. It's 100 times more powerful than morphine and 50 times more powerful than heroin. It's very easy to overdose.
And how do you get a hold of it? How are so many people?
It is in every illicit drug. This is something. And Paul, here's something I want you to remember. The weight of a single snowflake. The weight of a single snowflake. I'm coming back to that. So fentanyl is ending up in all illicit drugs, not just what people think might be heroin. It's also ending up in methamphetamine, stimulants, cocaine. We've also seen suspected evidence that it's in THC being used in vape pens and in street marijuana. And we want to raise a real alert that it's ending up in counterfeit or fake prescription pills. Now, the amount that it takes to be a lethal overdose.
How much?
What was it? That phrase I just gave you?
The weight of a snowflake.
The weight of a single snowflake. Fentanyl is so powerful. That's all that it takes to be a lethal dose.
Now, when you're talking like this, it's frightening. How do you know? How do you convince somebody just to stay away from this, because it could kill you?
One thing I want people to be aware of is that at the health department we do have test strips. So if people are still using, they can test it to see if it's present. That's one thought. The other thing are 3 N's I want people to know about. 3 N's, 3 points we're going to cover today. Naloxone, never, and now. Naloxone, never, and now. Naloxone is a medication.
Okay, I see it.
A little bit of that.
Yeah.
But it's a spray people can use to revive people from an opioid overdose. So it's easy to use in the nostril, call 911. If anybody's passed out for any reason, treat it like an overdose and use naloxone. So any Missouri citizen can buy this at your prescription. If you don't have insurance, you can pick it up at the health department. So naloxone can save lives. So if you know anyone who might occasionally use or experiment, or you have a loved one you're concerned about, or a neighbor, you can buy this to have it on hand to be able to revive someone. Or you're at a convenience store and somebody's slumped down in the doorway. It might be a drug overdose. All right?
Okay.
So that's one end, naloxone. You can save lives that way. Number two, never. I've been a preventionist for decades. I don't believe in scare tactics, but like you said, Paul, this is scary when it takes the weight of a single snowflake in a pill. So never take a prescription pill that isn't prescribed to you.
Right.
Never. And one of the concerns is that there may be people who don't like to smoke things. They have an aversion to needles, but a pill feels safe and familiar. And there's so many counterfeit pills because it's much easier to press the fentanyl and people will take it more readily, that those counterfeit pills are flooding the market. And the Drug Enforcement Administration says over 40% have fentanyl in them.
Okay.
So naloxone, and never take a prescription pill that isn't prescribed for you.
Got it.
Okay.
One more, and we're almost out of time, Heather.
Okay. The third is now. Now's the time to become involved. If you want to help, I'm going to give you how to reach me at the health department. Also now, if you want treatment, if you want help so you're not putting your life at risk every time you use meth that might be laced with it or cocaine, then you can call 1-800-662-HELP.
1-800-662-HELP.
Or www.findtreatment.gov.
Okay.
And they can call me at the health center, 573-874-7355. Again, if you don't have insurance, you can pick up naloxone at the health department.
Okay.
Again, naloxone, never a pill not prescribed for you, and now's the time to help and get help.
All right. Heather, thank you. I got one real quick question. We are out of time. Is fentanyl ever prescribed in legal prescriptions? Is it ever in? It is in.
It is. But this is backed by pharmacists who clean off their scales and can weigh the weight of a single snowflake. Most of our illicit drug dealers might not even clean off their scales, and they're not able to weigh to that capacity.
Thank you so much, Heather. I appreciate you coming by, and stay healthy. All right?
I'm working on it. You too, Paul.
Thank you.
Bye-bye.
For more information, you can contact Heather at the Columbia Boone County Public Health and Human Service Department. Drop me an email, pepperp@missouri.edu. Bye-bye.